I had an operation in November 2022.
It has been roughly 18 months and the weight is
a
1.5.
year and a half now.
1.5 years ago. The surgery scar is visible here, my dear external voice friend. It has nearly assumed an unclear state. The visual I described as the 90% unclear state during patient examinations is what you see here. Our scar is like this 90% of the time, friends. Our patient, Mr. Uğur, has never engaged in sports. I am not putting in any effort. How you did it is not a problem. The result is truly beautiful, and our scar here is also very nice. If we do some exercise to enhance this pectoral muscle, then they would score 110 out of 100. I saw it very beautifully. Keep your belly. There's no trouble that signifies wealth.
It was not only
Thank you,
that,
Professor.
I had a significant gynecomastia, but my armpits were also filled. So, thank you very much. You reduced me
very
to
much.
2.5 sizes. I really appreciate it. I saw Ali teacher on social media. His assistant, Mr. Ilke, is an old friend I have known for many years. Afterward, I was very troubled by gynecomastia for many years, so I did a lot of research. Look, it took about 1 to 1.5 years to get through this.
Is it the same as Ali Mezdeği?
Yes, I was indeed coming. I first visited Dr. Ali for a checkup. He suggested surgery, and it took me a year and a half to find the courage. I'm 43 now, and it's been 1.5 years since my surgery. That means I was around 41.5 when it happened. Afterward, I asked myself why I waited 40 years. Actually, it was quite easy.
What was the main issue you complained about the most with gynecomastia?
Those experiencing gynecomastia will fully grasp my point. If you have it, you naturally stand like this. Why is that? Because you wouldn't want to make that face. It doesn't look good on men, and you end up wearing clothes 2-3 sizes bigger. As I said, you walk around hunched. Even at the beach, you only want to take off your shirt when you're going in and out of the water.
Have you ever tried to deal with this through sports? We don't do
But
that.
let me clarify. You know about gynecomastia, but I'm explaining it for those who might not. Gynecomastia is a condition. There's no way to get rid of the breast tissue through exercise. Besides, you have a lot of old videos. There are athlete friends present as well. I don't have that kind of personality, but they have gynecomastia too. It's an unfortunate condition. Maybe it's hormonal.
There is a champion in Turkey with gynecomastia.
I saw it. I really did. I'm quite confident about this topic too. I had a significant amount of it as well. After trying and realizing it wouldn't go away, especially with exercise, it became a last resort. That was 25 years ago for me. I have times from when I was a swimmer, where my body was triangular. I had quite noticeable breasts.
It was even there.
Yes, it was there. I was the first patient of the morning. My teacher told me to come around 7:30. We went. They arrived in the morning. I encountered someone very cheerful and playful. I went to my room. This whole process took about 15-20 minutes. After I went to the room, my teacher arrived. He did the drawing, we spoke, our tests were performed. So, I think blood tests and things like that were routine before each surgery. After that, he told me I was the patient with the most prominent breasts this month. In gynecomastia, it's not only the breast tissue involved. In Ali Hoca's gynecomastia surgery, he removes more than just the man's breast. He performs chest shaping. I was roughly 100 kilos before surgery. My arms, underarms, and chest area were really fat. I'm sitting here now, and it might not show much, but after the operation, when I got out, I got smaller by over 2 sizes. I don't want to claim 3 sizes, but it's more than 2. I lost roughly 5.5 kilos of fat, and I think you refer to it as glabellar tissue. I was weighed directly there with a 5.5 kilo deficit. The reason I had this done here was already my own, because I also did a lot of research, you see. I've seen so many specialists. Now that I say this, it seems like other doctors can't perform this. They produce varying results and have different experiences. Some are happy, some are not, but I haven't seen anyone dissatisfied with Ali Hoca. I also have a friend at work who had it done at another place. He mentioned it happened about 8-10 years back. So it's almost like how I used to be. I told you so many times that you had gynecomastia surgery for nothing. Then the method is different. They do it with an incision on that part. So it doesn't make an incision from the top, inside, or middle of the breast. They also go away with the creams you provide. I have no idea why I waited 40 years. I'm really happy now, But there's one thing, there's only one reservation. If you have a belly, when this area is flat, it seems like the belly is sticking out. Lose some weight and do some exercise. It wants more afterward. Do you have any pain? No pain. You have a corset on. It's been fitted. You can only feel how tight it is. If I remember right, Ali Hoka gives it for 15 days. I think a year and a half has passed, but I can't remember. Don't take it off, please. I was a bit naughty. After a week, I thought everything was fine. I decided to take it off. Then I came for a checkup. When I came for the checkup, Professor Ali looked at me directly. He furrowed his brows slightly. Then he said, "Let me give you another 15 days of penalty." But thankfully, after another week, the process was done. Friends, the first 2 days with the corset were hard. It's tough. It wants to get used to it. It's hard because it's something we don't wear, like how hard it is for someone who doesn't wear a tank top or a wool sweater. You will experience pain on your first night. Anyone who says they don't is lying. It's quite severe indeed. What kind of pain? It's a restrictive pain that limits you. Ultimately, due to the fact that there is an operation happening there, you should lie on your back. If I turn to the side, take the pillow, and perform your actions to wrap around it, you will sense the discomfort as you utter "ah." The reason for the pain is the stitches located here. The areas that hurt are not the ones being treated much. You have stitches and other related matters, which cause you to sigh. After that, I was quite comfortable on the second night. I started working on the second day, by the way. I was discharged around 12:30 on the day of the surgery. 1 or 2 days. I was also discharged on the second day. I spent that day resting entirely. After the checkup, the corset is removed. Once the corset is off, you can take a shower. You are resuming your everyday life. You give one of those aesthetic creams to prevent the aesthetic stitches from being noticeable. If you follow it to the letter, we'll show it to you shortly. I mean, if we're going to take it in the image, there's no proper trace, nothing remains, there's nothing disturbing. The pain of this job, if we rate it out of 10, the pain for the first night is like a 5 out of 10. By the second day, it drops to a 2 out of 10. After that, nothing remains. So, should I have this surgery? Is it very painful? Even asking such a question seems pointless, because of the comfort that follows afterwards. Next to that pain you are feeling, nothing at all. If you have a tooth extracted, it will hurt even more. And there's also this. I'm saying that because of my bending and standing, I had pains in my lower back and my back. I was searching for answers, changing my bed, trying different things, but no. It was because I was slouching throughout the day. My wardrobe changed a little. I got clothes 2 sizes smaller. I'm really happy. At the beach, I take off my clothes as soon as I sit on the sunbed. These are my real feelings. That's how it goes. I suggest you try it. I will be doing this. I will be. I have a budget for this. I have time for this. If everything is in place, bro, then why are you hesitating?